Welcome to Environmental Fridays. It is Personal, Season 2. You can learn more about our topics and speakers by joining our Environmental Fridays Facebook group. This series is brought to you by Best Early, the Benton Spirit Community Newspaper, Andrews University Community Engagement Council, GC Scored, Every Piece Matters. Introducing your host, Dr. Desmond Hartwell Murray, and this week's co-host, Akashi Eminem. This week on Environmental Fridays, we'll be hearing from Dr. Susan Buchanan.
All right, so we want to welcome everyone again to Environmental Fridays. It is Personal, Season 2. Today we were supposed to have a co-host, but haven't seen her yet, so we're going to be moving on. One of the goals that we had for starting Environmental Fridays was to help mentor our next generation about the environment. But I'm thinking about that and I'm like, many of these young people are ahead of us, but nevertheless, they still need the knowledge. And so that was our original goal. And of course, we reach out to anyone who is interested, and everyone should be interested because it is personal. And one of the things I try to emphasize as well is that life as we know it will not exist without the environment. There is a symbiotic type relationship between the environment in which we exchange energy and matter. So it is essential to life. Consequently, I think that should make us humble to the environment and be stewards of our environment. So we've done a number of different presentations and episodes starting from September 2021 last year. And a number of these were covered. And again, in most cases, these topics are things that connect directly to us. We live in it. It is personal. We think that we would like this series to be one where we increase awareness and enlightenment, and then that encourages us to go out and be proactive and take care of the environment. So at this point, I will introduce our speaker for today. Dr. Susan Buchanan is a clinical associate professor of environmental and occupational health sciences at the University of Illinois, Chicago School of Public Health, and is director of the Great Lakes Center for Reproductive and Children's Environmental Health, which I actually checked out this morning. This center is funded by the U.S. Environmental Protection Agency and the CDC's Agency for Toxic Substances and Disease Registry, is designated as the Pediatric Environmental Specialty Unit for Federal EPA Region 5. She's board certified in occupational and environmental medicine and sees patients at the University Health Services at UI Health. So it is my pleasure, my honor to introduce you and to have you talk to us today about air pollution and children's health.
It's great to see everybody. Thank you for that introduction, Professor Murray. I always joke that my almost 10 years working in family medicine, kind of in the trenches, seeing patients a day, was a time that my bio would have been very short, just family physician, period. And I worked a lot harder than I do now with this long introduction. So people in academia love these long introductions. So shout out to all the doctors out there that are working really hard every day. Anyway, greetings from University of Illinois, Chicago School of Public Health. I'm really happy to be invited today. We're going to talk about air pollution and children's health. I noticed that on the list there were a lot of science-based, climate, environmental topics, and we're going to spend a little more time on health, that intersection of health and the environment, which is what I love about this field of environmental health sciences at our School of Public Health. So This is a federally funded program that supports me for doing this work, so I am required to put an acknowledgement to EPA and ATSDR and a disclaimer that I'm not representing them. So let's talk about air pollution and what we mean when we talk about this generic term. These are the lists of, this is a list of the main components of air pollution in terms of, what affects our health when we breathe it in. And one of the really important ones is particulate matter. We call it PM, different size, 10 microns is PM10, PM2.5 is these particles that are really small, that when you breathe them in, they make it past the nose and all the mucus up here, make it into the lungs and down into the very smallest components of your lungs. So PM2.5 is very dangerous when you breathe it in because it then can cross right into the bloodstream and go off and cause health effects. And particulate matter, let's also talk about where this stuff comes from. Particulate matter is generated when you burn anything. So the little graphic here shows a tractor. So that's a vehicle without a catalytic converter. So it is putting particulate matter right into the air. There's a diesel truck, and then there's a fire. So basically burning anything, it could be virgin redwood forest, and it's going to create particulate matter that's going to potentially hurt your lungs. So carbon monoxide and ozone, everybody knows about. And then sulfur dioxide and nitrogen oxides are important components of air pollution, also made by burning things, mainly fossil fuels in power plants and traffic. So the top two sources of air pollution are power plants, mainly burning fossil fuels like coal and natural gas and petroleum from vehicles. And then of course we worry about chemicals. I have been closely involved with ethylene oxide emissions to communities around Chicago from plants that sterilize medical equipment. So it's a difficult problem because ethylene oxide works great to sterilize medical equipment very easily and quickly. You can actually put medical equipment that's already wrapped in its little plastic package covered with one of those surgical towels in this silver tray, this tray that gets taken into the operating room. You put the whole thing wrapped in plastic, and then they use ethylene oxide and it gets into everything and sterilizes it. Unfortunately, it also is emitted from those plants and it's a carcinogen. So that's an example of a chemical air pollutant. And then radon, people might have heard of, is very dangerous because it's radioactive. It's an ionized radiation that comes naturally from the Earth's crust. And it can be pretty close to the surface, so it can leak into basements. So if you have a basement that's built down into rock where there is radon, you can have radioactivity that's leaking coming into your basement through all the cracks. And so radon detectors are important to detect for that. And it's kind of interesting. What are you going to do about something that's given off by the Earth's crust? What you do is you put a little fan in your basement with a little chimney and you just send it out to the air. So one of the things they used to say is the solution to pollution is dilution. And we don't really think that anymore. Because look what we did, look what happened, when we thought it was all going to be diluted, and now we've got global warming and the oceans are actually full of plastic. So anyway, but we do use that for radon. So those are the major components when we talk about environmental health of air pollution. Now, I'm also focusing on children today. So what's special about children that makes them more important than adults? Well, in fact, they are more susceptible to environmental exposures, and this slide explains why. I think that the analogy with canaries in the coal mine is a good one. And younger people, I use this analogy, I speak to students. I just gave a lecture to undergrads this week. No one had any idea what a canary in the coal mine meant. We use it as a term now but it was based in history. And these are pictures of actual canaries in their little cages that were taken down into the coal mine, into mines, not just coal, but any mines, because canaries would keel over and die when the carbon monoxide levels got high. And the miners would keep an eye on the canaries before they had carbon monoxide detectors. And if the canary was passed out in its cage, that meant you needed to get out of the mine immediately. So why did the canaries pass out before miners would pass out? Well, it's the same reason that children are more susceptible. Children have increased breathing, so they breathe more air per body weight, so 400 milliliters per minute per kilogram body weight than adults. We breathe only 150 milliliters per minute per kilogram. So they're breathing in more air. Children are eating more food, so 45 grams per kilogram per day versus us adults that take in 10 to 15, some of us more than others on bad days. And we also drink more water. I mean, children drink more water. So I see them as these little metabolic machines. They're breathing, eating, drinking water because they're growing. And you can imagine if there is a contaminant in the air or the water or their food, like pesticides, then it's going to affect them more health effects than in adults. And there's another reason we talk about children. This is a graphic of the developing brain that shows the comparison between the density of neurons in a newborn's brain and a 2-year-old's. So look at all those neurons and connections that are developing in the first 2 years of life. And if there is a contaminant like lead, for example, that the child is exposed to, and lead crosses the blood-brain barrier and gets into the brain, and any contaminant is just, these neurons are bathed in this contaminant, and you can imagine the neurodevelopmental effects. In adults, you don't see this, density change. It's already developed. And so that's another reason we pay more attention to children when we talk about environmental exposures. And there's one, I forgot one slide, is the third reason, is because children put things in their mouths more than adults. So there are a lot of contaminants in house dust and soil. Kids eat dirt. They put their toys in their mouths. They put their hands in their mouths that have been playing in the dirt or in the house dust. So it doesn't take a lot of lead, for example, or flame retardants chemicals from furniture to get into the house dust, and the child then ingests it. So I'm going to focus on asthma today as the primary health outcome of air pollution. Air pollution can cause other problems with growth, and it crosses the particulate matter, can cross the placenta and affect infants. I'm going to focus on asthma because it's such a common health problem. So this graphic shows what's going on with asthma. You've got the normal airway there in the lungs. It's nice and wide, and you can see the airway wall is really kind of way out in the edge. And then during asthma, what happens is people are exposed to a trigger, and the wall of the airway swells up. And you can see that bottom right, how that thickened airway wall fills up with mucus from inflammation, and how that can be so hard to breathe when the airway thickens like that. So that's what we're talking about happening with asthma attacks. So how bad of a problem is asthma? Remember, if you know the difference between prevalence and incidence. So prevalence is how many people have the problem at any period of time. So this is a graph from the CDC of the year 2019 and how many people, how many children in the US had asthma. And the different states, it shows you the different percentages there. So in the red states, between 9 and 12% of children were diagnosed, had asthma during that year. So that's a lot of kids, 1 out of 10 kids in those red states. Michigan there is down 7%. That's still a lot of kids. That's why our schools are filled with, kids that have inhalers in the nurse's office in case they have symptoms. It's a very, very common problem. And with asthma, it's not just, well, you just take your inhaler when you're wheezing. Kids end up in the emergency room. And when kids end up in the emergency room, they miss school, their parents miss work, and this just shows the number of emergency room visits, also from the CDC. And you can see on the left, the y-axis, it's millions, 1.5 million visits over those years. So lots of trips to the emergency room. And then, oh, what happened to that? Oh, that's so weird. Okay, there, sorry. Here's asthma mortality. So mortality, oh, I was also going to explain another public health term, morbidity, medical term too. We use morbidity means how much illness, and mortality is how much death. I still don't know what's going on with that. That's weird. All right, so here's deaths. Just to remind you that there are thousands of deaths from asthma in children every year. The y-axis again is showing 3,000, 4,000, 5,000. So it's coming down since 2001. That's good, but you still have a rate that's over 10 per million children die of asthma every year. So it's not to be trifled with, this diagnosis of asthma, because it can be fatal. And there is a race ethnicity disparity. Asthma mortality, here's data from 2019 showing that white non-Hispanic mortality rate is about 10 per million, but look at Black non-Hispanic is way up over 20, maybe 25 per million. So much higher disparity among Blacks with asthma children with death. So more Black children are dying, higher rate. So let's go back to the environment and look at what in the environment triggers asthma symptoms or asthma attacks or causes asthma. And we'll start talking about indoor pollutants, because indoor pollutants may be more important than outdoor pollutants. Americans spend more than 90% of their time indoors, either at home, work, school, daycare. And especially during COVID, when many of us are working from home, it's important to remember that older homes do not have continuous air turnover. If you're working in a public space right now, or going to school in a public space, by law, there are air exchange rates that have to be met. And that's why all the ceilings have different vents. There's an intake vent that's taking the air out, and then a vent that's blowing the air in. And I don't have those in my ceilings here. So this air at home, this air is not turning over. So air quality at home is often much worse. So that you have things like the dust mites, cockroach pieces, hopefully not in my house, haven't seen any lately, but I did when I had an apartment in Chicago, pets, molds, all of those can, once they get in the air, that stuff just stays in the air inside your house. ETS is environmental tobacco smoke or secondhand smoke. Irritant chemicals, we'll talk a little bit more about those. And once again, this particulate matter, which can be a problem at home. If from your gas, it's coming from your gas stove, if you have a wood stove, if you use space heaters. Remember I said, when you burn anything, you're generating particulate matter. And then you can have ozone in your house from those, some people like ozone generators. They used to be thought to be a wellness kind of air quality improvement, but they actually can be pretty irritating. They can be irritating to the lungs, especially for people with asthma who are already sensitive to irritants. So what we talk about asthma triggers, what triggers wheezing. So a trigger is an airborne item, anything that can bring on an asthma attack, but they're often allergic, they can be chemicals, or they can be moisture related. Any of those can trigger asthma attacks. So there are some triggers that have scientific proof that they can cause asthma. And I'm going to go through these one by one. So house dust can actually cause asthma, cats, cockroaches, tobacco smoke, mold, dampness, and nitrogen dioxide, which is given off by gas ranges. So let's look at some of those. So this is pretty gross. Dust, house dust is actually a little insect, very microscopic. They live off of fabric items. They feed on shed flakes of skin. Okay, that's really gross, but it's around us. There's nothing you can do about it. I mean, you're not going to be able to get rid of all the dust mites. And when you study this stuff, you just have to think that we're all symbiotic, and those dust mites have been around me my whole life, and they're not bothering me. They're not going to start bothering me now, but their body parts and feces can trigger asthma. So really dusty environments, that dust gets in the air and children breathe it in and can cause wheezing. And this is a picture of just taken from an asthma website showing a bedroom with a lot of fabric. So you've got these big stuffed animals, you've got the fabric bedspreads, and then their beds are covered with stuffed animals. So stuffed animals are really famous for collecting dust. For kids with asthma, they're supposed to minimize their stuffed animals, or at least wash them weekly. So get them in the washing machine to get rid of the dust. And kids who have bad asthma, this room is carpeted as well. Kids with asthma should have non-carpeted floors if possible, because the carpet collects dust as well. So animal allergens, lots of people are allergic to animals. Not everybody, not all of them have asthma, but kids with asthma who are allergic to animals, this can trigger wheezing, but it's not caused by the fur. It's caused by the dander, which is little protein particles from the saliva or the oil glands. And these can persist indoors even after the animal is gone. They're kind of in the air, the dander settles on things. So this can be a problem. And we've definitely had kids with bad asthma who have cats. And it's really hard to tell a family that you think that they should get rid of their cat. And oftentimes they don't get rid of the cat. So they just try to manage where the cat hangs out, which is really difficult because this dander persists. Cockroach allergens. So the allergens are in the droppings, body parts, and saliva of cockroaches. It's important to know they follow food and water sources. So any crumbs, any any water sources that are any leaks, it's going to be more welcoming to cockroaches. So fighting them means really keeping the food packaged and the crumbs up. And they are difficult to get rid of. So this is one of the reasons that can help explain why the rate of asthma is higher among African-American children because of low housing quality. So African-American children in busy industrial urban areas can live in disinvested areas. The housing stock is not kept up as well, and this can lead to cockroaches. If all the cracks and the seals are not treated and closed up well, or not sealed, then you can have cockroaches. And it's possible that these allergens for cockroaches are contributing to this higher rate of asthma, hospitalizations, and mortality in urban areas. So mold, mildew, and fungi. So those three terms all mean the same thing. Mold is the same as mildew, is the same as, they're all fungi. And the spores can be found both indoors and outdoors. And there are times when, if there is a leak in a home and poor ventilation and something for the mold to grow on, any porous surface, mold is going to grow. And mold loves warm, dark, humid areas like your shower. And so mold grows in bathrooms, it can grow in attics, laundry rooms, basements, anywhere where there might be a water source. Outside, it grows in moist, shady areas, compost piles, rotting wood, falling leaves. So mold is another thing that's around us all the time. The bathroom is going to grow mold no matter what you do, because there's such great source of water. But if there's too much mold, the asthmatics can start wheezing. And these are pictures where there has been mold overgrowth. We see a lot of kids and adults too that come to our clinic, our environmental health clinic, with photos of mold overgrowth in their homes. And unfortunately, one of the things that has happened is we're building our buildings really tight. They don't breathe. They've got great windows. They've got great seals to save on heating and air conditioning. But when you don't have that air movement in our homes, that's when you can get mold growth, because there's no ventilation to dry it out. Something leaks, you get mold overgrowth. So this can be a real problem for environmental problems for asthmatics and all of us. And I mentioned nitrogen dioxide because there are people that use gas ranges for home heating. I have done home visits on families that had all 4 burners going to heat their home to save money on heating. When you burn that natural gas right there in front of you, it's giving off nitrogen dioxide, it's giving off particulate matter that's going to be irritating. So also improperly vented fireplaces, malfunctioning furnaces, wood burning stoves, kerosene heaters, these can all give off nitrogen dioxide that can make asthma worse. So really important indoor air pollutant. And I guess I'll just throw in there, because I'm also very concerned about climate change, that there is a movement now to make buildings completely electrified and get rid of all the gas plumbing. So no gas lines into homes, and this needs to be the wave of the future, because the natural gas going into homes is contributing to global warming and climate change. So hopefully within 20 to 25 years, all new buildings that are built will have only electrical everything. So the stove's going to be electric, the dryer is going to be electric, the heating is going to be all electric, because we can generate electricity with renewables and get rid of natural gas completely. So let's move to outdoor air pollution. We already talked about the sources: ozone, sulfur dioxide, particulate matter, nitrogen dioxide. I took this picture of Benton Harbor off the web. The air doesn't look too bad. Looks like a hazy day. Not too bad. But all of these air pollutants that we mentioned, and I do want to spend a moment on ozone. So those of you who are climate and environmental scientists already know this, these students that are learning about the environment, that ozone up high is very protective of our atmosphere, and it keeps us our atmosphere safe and healthy for breathing. So up high, ozone is good. The problem is down here where we are, ozone is generated from burning fossil fuels. So you burn fossil fuels on a warm, sunny day. So sunlight, fossil fuels, heat equals ozone. So it's a chemical reaction that I don't remember because it's been too long since I took chemistry, but ozone is generated on these hot, humid days near traffic, and then you get the ozone action days. And ozone down low is bad for our lungs. Sulfur dioxide is given off by coal-fired power plants and burning fossil fuels. We already talked about particulate matter, traffic, coal-fired power plants, nitrogen dioxide, traffic, coal-fired power plants, and natural gas plants too. So all of these affect our lungs. They can cause, even if you don't have asthma. So on these high ozone action days, you can get a runny nose, wheezing, sneezing, shortness of breath, throat irritation, even if you're not an asthmatic, from the air pollutants. Those with asthma can have an exacerbation. If you have heart disease, you can have an exacerbation or a worsening of your congestive heart failure. You can get chest pain on those days. And that's not just from not just from not getting enough oxygen because the air pollution is bad. Remember, I mentioned that particulate matter is so small. Some of the particles are so small, they actually go into your lungs, cross into the bloodstream, go to your heart, the small vessels in your heart, and cause inflammation. So there are more admissions to the emergency room with people with angina, chest pain, on high pollution days, because those particles are getting to their heart and causing inflammation. So, all right, let's do some audience participation. Let's look up the air quality index. So go to your smartphone. So it's the one time of the presentation. I want you to look at your phone. Look up the air quality, the AQI. Look up the AQI, either in the area you are, or if you're a student, away from home, you can look up your home. Look up the AQI somewhere right now on your cell phone. So I'm going to do that or on your computer, whatever. I'm going to Google Chicago's AQI today.
Mine says air pollution level is good. Air quality index is 21.
Right.
Main pollutant PM 2.5 in Berrien Springs.
Great. Did anybody find something higher than, what was it? 20 what? 21?
21 AQI.
I've got a one in Oak.
Mine says 46.
Where are you?
Where are
I'm
you?
in Hope Mills, North Carolina, but when I click it, when I searched it, but maybe I'm looking at the wrong thing. It's saying, yeah, near Douglasburg School, the AQI is 46 AQI good.
In North Carolina?
Yes, I'm in Hope Mills, North Carolina.
Oh, okay.
Interesting. Okay, well,
okay, mine says 52, moderate. Air quality is 52.
Okay, that's a little worse.
And where are you?
Newington, Connecticut.
Connecticut?
Yeah, 52. That's
okay. So the EPA determines this number daily. It should list which one of the air pollutants is the main contributor. And then it also lists sensitive subgroups. So here's what the chart of the different levels. So it sounds like most areas were under 50 today, which is not surprising in the wintertime. Like I said, the ozone requires heat. And so in the summer, the ozone, the air is often worse. And the meaning here is on the right. So up to 50 is in the green zone. So it's considered satisfactory. Air pollution poses little or no risk. And once you get above 50, it's called moderate. I think that one in North Carolina was moderate. It's acceptable, but for some pollutants, whether it's PM2, ozone, sulfur dioxide, whatever, a very small number of people who are unusually sensitive might have symptoms. Now, at least in Chicago, in the summer, we do get air quality that is over 100. I mean, AQI that is over 100. At this, 105, 110, at these levels, there are sensitive groups that may experience health effects. Now, what are sensitive groups? We already talked about children because they're breathing in more air than we are, than adults are per body weight. People with asthma are certainly sensitive. People with any type of lung disease, emphysema, lung cancer, they're going to be sensitive. I mentioned that the particulate matter can cross the real small stuff, can cross into the bloodstream and go to the heart. So people with heart disease are considered sensitive. So when it gets up 100, they need to start thinking about changing their behavior and staying inside. Now, remember when, there were forest fires, certainly in the West Coast. There was the Olympics in Beijing where they closed down all the power plants like for a week and try to clear the air for the Olympics. Those levels were up above 150. So I've definitely seen air quality, not in Chicago above 150, but certainly in areas that have either forest fires nearby or areas, hugely industrial cities. So, okay, let me get to the next slide. So what do we do about it? Besides being activists to try to get the coal-fired power plants shut down and more electric cars built and more public transportation, from a health perspective, from a healthcare provider perspective, I hate this, but I'm supposed to tell people to stay inside on the bad ozone action days, which I hate doing because children need to be playing outside and all of us should be going outside every day to get some type of exercise. So, but check your local air quality to know when to play and when to take it a little easier. These are from the EPA's website. Schedule outdoor activities at times when the air quality is better. In the summer, this might maybe in the morning, because it's that heat that makes all the ozone. So it's ozone and AQI is usually the worst in late afternoons because you've had all day for the volatile organic chemicals given off by the cars and the heat to create and the sunlight to create the ozone. This is especially important for kids who have asthma. So if there's a kid that has poorly controlled asthma and stays on the softball team and it practices in late afternoon, that athlete may need to stay inside on those days when the air is really bad. So staying inside with the windows closed on high pollen days when pollutants are high, and consider a HEPA filter or better HVAC to reduce fine levels of fine particles inside your home. So people who have bad asthma might think about getting one of those HEPA filter machines in their home to keep the levels of indoor air pollutants down. The EPA has a really nice website on asthma triggers for people who want to learn more. And then, oh, where's my slide? Oh, maybe I didn't save it. Oh, I had a slide somewhere about disinfecting by, I think I didn't save it. All right. I want to pivot really quickly and spend a little time on cleaners and disinfecting products because they are indoor pollutants that can contribute to asthma. And it's a situation that's gotten a lot worse during COVID-19 as everybody wants to clean and disinfect more. So I'm going to spend a few minutes on that and then we'll we'll have some questions. So the EPA and our children's environmental health centers are worried about cleaning and disinfecting products. So why is that? These graphs show the calls to US poison centers at the beginning through the pandemic. So look at how in 2018, 2019, the calls to poison centers about cleaners and disinfectants stayed level. And then once the pandemic hit in 2020, look at how those calls went up. So everybody remember when people were wiping off their groceries, like everything that came in the house was getting wiped down with disinfecting products. Oh yeah, I put it out of order. Here's the introduction to the section. All right. So why do we worry about these products? Here's just a little science-based info. Children who are exposed to cleaning products in infancy are more likely to wheeze when they're older. People who clean their own homes have higher rates of respiratory symptoms if they use bleach or multiple kinds of sprays. Those who do cleaning work have the highest rates of work-related asthma. So I'm also an occupational medicine physician, and so the diseases of workers concerns me, and work-related asthma is really common. You can imagine that nurse there cleaning the bed, if she's doing that multiple times per day, you can imagine the chemicals she is exposed to. So we want to distinguish between cleaning and disinfecting, because cleaning is just using a detergent and water to physically remove the stuff from the surfaces and flush it down the drain. This doesn't necessarily kill germs, but it works really, really well. And they found that COVID's, the virus's outer lipid layer is dissolved by soap and the virus falls apart. Now this word didn't get out. I think they were just wanted to be sure. And so disinfection was recommended, but cleaning works really well. It's been found to remove as much as 99% of microbes when microfiber is used. So, and the reason that this is important is disinfection chemicals are hard on your lungs, and some of them are endocrine disruptors. They affect other organs in your body. So cleaners are generally safer than disinfectants, which is why the EPA has been pushing this use of microfiber cloths. These, because you can use them with cleaners, not disinfectant chemicals, and get rid of 99% of the bad stuff. So these fibers are 200 times thinner than a human hair. They're really absorbent. They remove microbes and spores. They have a positive electric charge, which creates this electrostatic attraction. And there has been research on microfiber mop use in hospitals. If you use a microfiber mop head with a detergent cleaner, not a disinfectant, it removes bacteria as effectively. You can throw them in the washing machine. They dry fast, so it's difficult for bacteria to grow in it. So there's a real push for these microfiber cloths. So what is disinfecting? So disinfecting, clearly you need to do that in the hospital before surgery or in public spaces. It inactivates 99.999% of germs. But with disinfectants, when you spray them on a surface, there's a dwell time, which means you leave it alone. You don't wipe it off the surface. It needs to kill everything before you wipe it away. And the bottle usually tells you how long the dwell time is, and it's recommended, yes, to use it on baby changing tables and toilets and public areas like doorknobs, cabinet handles, and drinking fountains. But that's really it for the use of disinfectants. So let's go through some of these disinfectants that can be harmful to health. And the first one's bleach. So people go crazy using bleach. You know, they love it. It really does work well as a disinfectant because it kills the stuff, but does have a dwell time of 5 to 10 minutes. But if you have a large acute exposure, it definitely can cause coughing and wheezing, meaning a one-time use is bad. But also chronic low-level bleach exposure is associated with asthma in custodial workers. It's been responsible for 62% of the increase in poison center calls. So bleach, chill out on the bleach.
I can't even be around it.
Everybody could understand that. Chill
Yes.
out on the bleach.
So another chemical that's kind of insidious because it's so common are these quaternary ammonium compounds.
Yep.
And if you look at the list of chemicals on your Lysol or your other disinfectant, it often has ammonium at the end. And these are these quaternary ammonium compounds. And they do disinfect because they disrupt cellular membranes. They do need to stay 4 to 10 minutes, but they are known to cause asthma. And there's now emerging evidence of other possible mutagenicity, so affecting the DNA and reproductive toxicity in animal studies, and now some endocrine disruption as well. The research is emerging. These are chemicals that are allowed, lots of chemicals are allowed in our environment that shouldn't be, that are known to cause disruption of our hormone systems or reproduction, lots of those. That's a whole other topic about why those are allowed in our environment. But quats, as these are known, should be avoided. So much so that the American Academy of Pediatrics came out with a statement during the pandemic that said disinfectants such as bleach and those containing quaternary ammonium compounds or quats should not be used when children and adolescents are present because they are known respiratory irritants. And I would add, because there's also emerging evidence of other organs that are being affected by these compounds. So even the AAP came out with a statement, and CDC has a whole webpage on cleaning and disinfecting. And this is an issue in schools. I remember our center takes calls from parents and health departments. I remember a parent was complaining that at the beginning of the pandemic, these little like second graders were being asked to wipe off, they were cleaning their own desks, with the disinfection wipes. And this is a no-no. And even IDPH, Illinois Department of public health agencies are coming out and saying children should not be exposed to these. You know, the cleaning should go on in the classroom when the kids are not in it. Do not make kids clean their own stuff. They shouldn't be exposed to this stuff. So the key points, this is important too. The words natural, non-toxic, and green that appear on product labels are unregulated by the government. Researchers have found that products labeled green often have as many toxic chemicals as conventional cleaning products, so do not trust it when it says green. They don't have to list on the label all the ingredients, and manufacturers do not have to prove they are safe before they market them. That's what I said is a whole other topic of why the US chemical regulatory system is like that. And it makes it difficult for the consumer. So there are some safe labels. There's a green seal you can look for. There's an eco logo. And the EPA has this design for the environment project where they call their products, they put a safer choice label. So these are 3 labels that if you're going to use a disinfectant, which you don't really need in your home, if there's no public coming in, you could use one with these 3, one of these 3 labels. And this design for the environment from the EPA, these are the ingredients that they say are safe. So EPA says these are safe: citric acid, hydrogen peroxide, L-lactic acid, ethanol, isopropanol, and these are in, you know, hand sanitizers, peroxyacetic acid, sodium bisulfate. Those are the only active ingredients so far that have been listed as safe under this EPA project. And I think this is my last slide. This is a nice graphic from one of our pediatric environmental health specialty units out west that is dealing with a safe disinfectant. If no one's sick at home, use cleaning. You know, if someone in your house is sick, okay, then you want to think about disinfecting, but only use these certain chemicals. And then how to disinfect if you don't have access to safer products. So it's a nice graphic. Okay, so that's my last slide. I would be happy to take questions. I see there's a bunch of stuff in the chat, but I wasn't able to read it while I was talking.
All right, very good. Want to thank you, give you a round of applause here. I am particularly impressed with this presentation because it was very informational, but very clear. Okay.
Good.
Yes, get rid of that stuff.
Chill out on the bleach.
Chill out on the bleach. So my co-host, could you come on? My co-host, where is she? Keisha, are you there? On mute. Anyway, if you guys have questions, just unmute and ask your question.
Okay.
Well, I don't have a question, but I want to kind of piggyback a little bit about what she was saying about the disinfectant. My name is Cassandra Gilchrist, and I am one that has been affected with Clorox, Lysol. My whole world was turned upside down in 2017. So I have a condition that they diagnosed me with called irritant-induced asthma, along with something else. I keep forgetting the other name, but it caused me, they was using it in the job, kept using like wipes and stuff at the job where I was working at, and I was put out of work. I'm actually on disability because of it. So I do know that the Lysol, the Clorox, those are very dangerous for the body, and a whole lot of other stuff that she was saying. So yes. I'm glad that I was able to get on this call because, you know, people think it's in your mind when you're dealing with stuff, but a lot of other people, they call it multiple chemical sensitivity.
Yeah, well, irritant-induced asthma is definitely a thing. And when people are exposed and you do a breathing test on them, it does show that their airways are more closed than they should be. So yeah, there are definitely people who are sensitive to any of these indoor air pollutants, for sure.
And yes, they did do a test finally. But see, the sad thing about it, when I was going through it, these doctors around here in my area, well, I actually in Hope Mills now, but I was in Robertson County area. They knew nothing about what I was dealing with. I had to go to another county, which was Pinehurst, in order for the allergy doctor to diagnose me with what I got going on.
Wow. Wow. Yeah, that's too bad. I agree. It's not, that's another thing that, you know, this federal grant that I'm working under wants us to teach medical students and residents and doctors, because they don't learn about this stuff in medical school.
Yep. I remember you saying that yesterday or sometime when we were talking.
Yeah.
Yep.
Yeah.
What about vinegar? What about vinegar? Is vinegar okay?
Vinegar is great because that list had citric acid, which is what
exactly.
vinegar is.
Yeah, exactly.
Yep, vinegar's great. It's I guess it's kind of stinky. I don't know. I don't use vinegar all over my house. I should, but it's great.
Yeah, it's one of those natural hydroxy acids. So I assume, you know, like citric would work as well, and vinegar and stuff. Okay. Yvonne, you had a question?
Yeah, a comment question kind of thing. Thank you. This, like you said, this was a really clear presentation. I'm interested in the environmental factors, and you talked about the asthma and the instructional time that students lose in terms of academics. Also, one of the things I wanted to say too was a couple of things. One is it impacts their academic performance. And it also impacts their, I mean, have you guys seen this? It impacts their academic performance. It also impacts their behavior. And I think this is these are some of the reasons it impacts attendance. I think these are some of the reasons that students of color, especially African Americans or Black students, there's such a wide achievement gap when compared to their white peers in terms of academic performance, behavior. And I think one of the injustices that I see happening as a result of these environmental factors is these kids get sent home, disciplined harder. They lose out on many opportunities that their white peers have access to because they are in this under-resourced and highly contagious, if you know that's the right word, environments. And so I think that's something that maybe they need to teach them in medical school as well, and not be so quick to diagnose these students coming from these communities with mental health or learning disabilities. I think they need to look at environmental factors and see how they could make the environment more conducive to success.
Mm-hmm. Yeah.
So I just want to say that.
Yeah, I think you raised a lot of really important points about what we call now the social determinants of health.
Yes.
You know, it's all these different factors, and a child with asthma certainly can be stigmatized, and their parents are terrified to see your kid not be able to breathe. So of course, if there's something that's going to make them worse, you might want to pull them out of school, or and even the inhalers that are used for short term, like I'm wheezing right now, I'm going to use my inhaler. They make kids more hyper. I mean, that's the medicine.
Yes.
It's like a stimulant.
Right.
So yeah, that can be, you know, I agree with you. It can be this whole picture that asthma plays a role in. It's unfortunate.
And there's another thing you said about the disinfectants and the detergents that that are used for cleaning. If you would notice, a lot of people of color are the ones who clean these buildings. So they grow up being exposed. Then because of the opportunities or lack of access, and because of all those health social health determinants, they are then delegated to these low-paying jobs that again, on top of all of what they've already experienced, now they have to work in environments. So, so they're living in environments that are detrimental. They go to school in environments that are detrimental. Then they have to work in environments that are detrimental.
Yes, and now what you learn in occupational health is that people can bring home the chemicals from work on their clothing.
Exactly.
They can spread around the family, especially if it's dust, it can get in the laundry. If there's like metals on their clothes, like lead or beryllium, whatever, it can go into the laundry. And yeah, so there are jobs where the workers should be changing their clothes before they come home.
Oh yeah. Yep.
So just wanted to say that.
Other questions?
Yes, my name is Bilalian Rose, and I'm sorry I tuned in late, but I came in on the part about our environment with the chemical cleanings. But what escapes me totally on every front in every field is where we start with ourselves, with our babies, our children, is what we're allowing still. The bonbons, the candy, all the junk foods, chicken chips and all this is the first deterrent inside the body that it breaks down the whole immune system to begin with before you start this outside invasion, which is a struggle all the time on the inside anyway. But it escapes me. All of this is constantly going on. And it doesn't, in every store you go, it's lined up with your bonbons. And I just had the experience yesterday with still giving the kiddies donuts with the sprinkles and what have you. And that's where it all begins. If you got asthma and you continue to give your children cheese, milk, pizza, macaroni and cheese, where is the balance here? You know, we do have a villain. We do have a villain here. But in honesty, we need to expose all the villains. And the villain starts right what we put in, allow our children and ourselves to put in our mouth for our own strength, weaknesses, mental abilities, and all of that. It starts with your food. So I don't want to sound like the devil's advocate here, but it's just so important, and it's just such an oversight.
Yeah, no, I think when I give these lectures on children's environmental health only, I do recognize that I'm leaving out a lot of important determinants in children's health. This is kind of my little silo of expertise in medicine and public health. But I agree, diet and neighborhood and housing quality and education, all those things have a huge effect, especially, and diet plays a huge role. I totally agree. Yeah.
So one of the things, I don't know if you would classify this as important, but you talked about cat allergens. Are there dog allergens as well? Is that a issue?
God, that's a great question.
We always pick on the cats.
Well, I assume, yes. I mean, you can be allergic to any protein product.
Right.
So that means basically anything living.
Right.
What I was reporting is where there's scientific data of association with asthma. So there isn't scientific data proving that dog dander is associated with asthma, but there are certainly people that are allergic.
Right, right.
Yeah.
Okay.
I have a question.
Go ahead.
If I want to put some plants in my basement, that's I'm just wondering about the level of growing up, the fungus growing up there. So is that could affect or decrease the nitro carbon in my basement, and also increase the fungus growing because of the moist?
I've heard both things. there are people with bad allergies that don't tolerate plants in their homes well, if they're very allergic to the different components of the plants. But plants also do, as you know, they take in carbon dioxide and give off oxygen, so they can contribute to the better air quality. And yes, if you're watering things every day, you're bringing in a moisture source to the home, so there's some risk there. So I guess it goes both ways. I would probably promote plants in the home unless somebody has symptoms.
Thank you very much. Thank you for the presentation. It was great. Appreciate it.
Thank you.
Dawn, you have a question?
Yeah, I kind of had two. One of them, I've seen cleaning products these days and use them that say they have thyme oil as the active ingredient.
Yes.
I didn't see that on the list.
You know, back at the beginning of the pandemic, I ended up looking that up, and I agree that it was, I don't think I found any harmful aspect of it, and I'm not sure why it has been left off the EPA list. I'm pretty sure it's okay. And it's like THYMOL.
Yes.
Something like that.
Yeah, it is.
Yeah. Do you know, Professor Murray, about if it's
I don't know its toxicity and stuff, but I do know it's a natural product.
I think it's okay. Yeah.
And certainly I use it on cutting boards, and if it doesn't get completely cleared off, all you do is you taste a little thyme seasoning in your food rather than
Oh,
bleach.
nice.
Yeah.
And then my other question was, how much does low humidity in a house exacerbate some of this stuff? I know I always struggle at this time of year if I don't put my humidifier on.
Well, you know, it's the humid environments that are actually worse for asthma because of the molds that can grow. So dry air is typically not irritating to the lungs. Like in the old days, people with really bad asthma, bad lungs would move to Arizona because of the dry air would actually help their symptoms. So there are a lot of other annoying things about dry air in the wintertime, and we use a humidifier as well so that you don't get shocked every time you touch somebody after you walk across the carpet, but it's not going to be harmful to the lungs. The dry air is not.
Right. The information also about ethylene oxide. I mean, I know about ethylene oxide as a chemist, as a synthetic chemist, using polymers and stuff, but I did not know the information you shared about it being used as a protective or something for surgical and instruments and so on.
Yeah, it works really well as a disinfectant, and it's the most common way to sterilize medical equipment. And so there's a real grassroots effort now in different communities that are near these plants against ethylene oxide. And it's difficult because the pushback is, but when you have your heart surgery, you want the whole tray to be very sterile. You want it to be sterilized. And clearly it's really cheap because it's a very common chemical. So it's much less expensive, but the EPA in the last few years put out grants for people to develop alternatives. So there is some support. You know, hydrogen peroxide, hospitals use hydrogen peroxide. There are a lot of hospitals that have stopped using ethylene oxide and they're using hydrogen peroxide. But I think there's something about it that doesn't work on all products. So anyway, they are trying to promote more research to find alternatives to ethylene oxide.
Yeah, I know that came up in our very, very first Environmental Fridays, because there's a plant, or at least plants maybe, in what is called Cancer Alley out there in Louisiana.
Yep.
And so Miss Levine was our very first speaker, and she brought that up about the cancer.
Yep, well, Chicago area has several plants, and the state actually did a cancer cluster study around one of these plants, and it was a positive cancer cluster.
Wow.
So yeah.
It's real.
Yeah.
It's for real. Okay.
Go
ahead.
Now that you're talking about cancer, it just came to mind when I was part of this other program. They had spoke on where it was a test done for 20 years study of people that use Clorox and Lysol compared to people that smoke for 20 years. And from what they discovered, people that use Clorox and Lysol actually had cancer more than the people that smoked for 20 years.
Wow. Yeah, I haven't seen that.
Did you believe that?
Yeah.
The company Melaleuca has it documented.
I'm familiar with that company. Yeah.
Okay. Any other questions? I think we had a very good session today, and I would end by thanking everyone that showed up here as a participant, that asked questions, made comments. That's how we learn and we make things better by getting this type of information. Especially like to thank Susan Buchanan. I got connected with her through Laurel Berman, and Susan, we're gonna be in your life for forever.
Sounds good. Sounds good.
Yes. Yeah. Also want to give a special shout out to one of our sponsors. The Benton Spirit Community Newspaper is now celebrating its 20th year in existence. Everyone on here should go to the Benton Spirit Facebook page and website and say congratulations. It's been a long journey. It's been all for the benefit of the citizens of the metropolis of Benton Harbor. So we want to thank the Benton Spirit, and of course, we can't fully thank the Benton Spirit without thanking the visionary leader and persistent activist, Princella Tobias. I think we need to give her a round of applause for all that she's done and continues to do for our community through the newspaper and many other things. So with that, I would like to close and invite every one of you again to share the information about what you learned here today. Is very important. The YouTube video, the video will be on YouTube by the end of the week, by the weekend, and I'll send out the link to everyone to look at it on your own time as well. Thank you so much, and have a great rest of the day. Okay, take care.
Thank you.
Bye-bye.
All right,
Goodbye.
bye-bye.
Yeah, thank you very much.
Great presentation.
Thank you.
Thank you.
Yes.